Hi there, my name is George Aliphtiras, Executive Director and co-founder of Synapse Dental. In this podcast, you'll learn about the release of the dental pain eraser to the dental industry.
OrthoMarketing.com, 360-degree digital marketing solutions for your practice.
Well, hello everybody out there in podcast land. This is Dean Steinman from Ortho Marketing. And guess what? We are back with another podcast for you. And hope everybody is doing well. It is now springtime 2024. And spring is in the air. People are smiling. People are happy. Flowers are blooming. Baseball's back. And I'm very excited today to have a very timely guest, have a great big person and company for you to learn about. And I'm very, very excited to have with me today George Aliphtiras. And George is the Executive Director of Synapse Dental. And we're here to talk to you about some great technologies and great things in the industry. So George, welcome. How are you today?
Hey, Dean. It's great to be here. Thank you so much for the invitation. And it's a lovely spring day where I am too. So it seems to be North America wide that spring is here and the birds are singing and the sun's shining. So
you gotta love it. But the birds are singing, sun is out. There's no eclipse today, so it's a good thing. So George, welcome. So we're gonna jump right into it. So Synapse Dental, we're working with you, we're partnered with you as far as the marketing goes. But let's take a step back. Tell everybody who is Synapse Dental and what is it that you guys do.
Yeah, glad to do so. So we are a startup company focused on the dental and consumer oral health industry. And really, we're transforming the patient experience. And how do we do that? We're basically removing the pain from the treatment journey, both in office and also at home. So we're really trying to transform what typically in the past, like most patients are very, obviously, may not have a very positive experience going to see the dentist during their chairside treatment and also post-appointment. We're actually revolutionizing how that pain is now vanishing from both the chair and also at home.
It's funny that there are the two biggest fears that people face are public speaking and going to the dentist. And it's funny, the misconception that people have going to the dentist and they're afraid going to the dentist because they think it's going to hurt. So tell us a little bit of the genesis of Synapse and how it came to be.
Yeah. So it really started from the clinical need and the patient problem of that kind of fear and also just the reality that dentistry or just treatment can be uncomfortable or painful. So my co-founder, Dr. Cosmo Carambidis, was practicing at Boston University and also in his private practice, and really had a constant, issue of, all these patients coming in and not having good solutions to treat at chairside and also at home, because, you treat patients, but, again, it's about being empathetic. We want to give the best care. As patients, we want to receive the best care, but how do you kind of tackle the problem of giving great experience at chairside and at home? So he really went on a journey and explored what possible technology solutions could be applied to address this big problem of dentistry. And he had a eureka moment, let's say, of using neuromodulation, long used in medicine, and really now becoming integrated into everyday use more so, but applying it to dentistry and consumer oral health. And I know what is neuromodulation?
That was my next question, right?
Yeah. Next question. What is it? Well, it just a electrical stimulation. In this case, it's subsensory. So really, you might feel a tingle, but ultimately you're blocking the pain signal at the local level. So it's not systemic. It's not affecting the body. You won't have the big, profound numbness that overwhelms you when you have that wisdom tooth extraction. Like I think everyone's had some sort of extraction likely, and you always will have some numbness, or you might even have GA, right? And that post-op pain is not very fun.
Right. Interesting. So let's talk more about that eureka moment. How did that actually come to be? Did you or Cosmo wake up one day and just said, this is needed? Or what actually, how did it actually happen?
Well, he was dealing with a lot of chronic pain patients in his clinic.
Okay.
Especially at the university, you always have the most sensitive or the most vulnerable patients coming in. So he was dealing with those patients, and really found the opioid, narcotics, and just traditional topical or injectables not really being effective to deal with that long lasting. Like, how do I effectively give relief for a long period of time? And also the fact is, a lot of these are invasive. So you have to can I eliminate the whole invasiveness needle component? And there's also contraindications. I mean, we know that substance abuse, or especially these days, it's an issue with opioid epidemic. It can affect people. Unfortunately, it does lead to lives lost because people are abusing these powerful tools to deal with pain. And that led to, is there a safe, non-invasive, sustained pain relief that is also effective to remove pain discomfort? And that led to kind of that eureka of neuromodulation, electrical stimulation. I mean, it's a new category in the dental anesthesia. We call it electronic dental anesthesia. And the proprietary name is pulse wave technology.
This podcast is sponsored by orthomarketing.com. Hey, you an orthodontist or dentist looking to give your practice the competitive edge it deserves? Well, look no further than Ortho Marketing. Ortho Marketing is the dentist and orthodontist choice for digital marketing. At Ortho Marketing, we specialize in helping orthodontists and dentists just like you attract more new patients. Our team of experts knows the ins and outs of the dental and orthodontic industry, and we're here to help your practice shine. We're going to supercharge your online presence. We're going to optimize your website. We're going to harness the power of social media to connect you with the patients that you want. Say goodbye to empty chairs and say hello to a thriving practice. Choose Ortho Marketing today and watch your patient list grow. Visit orthomarketing.com and learn more and take the first steps towards your practice success. Ortho Marketing. It's not just our name, it's what we do. Really? Okay. So what is Synapse? What's behind that?
Yeah, and really our mission in Synapse is really we're establishing a new patient comfort standard in dentistry and also at oral home care, making treatment and oral care more comfortable. So that is really our mission of everyone should be comfortable at home, comfortable at chair, and having a really good experience. I mean, it doesn't have to be that, gee, I'm kind of anxious or fearful, or because even tell you a story about my mom, who, she's unfortunately she's one of those anxious patients, and she always cringed to go for her cleanings, and she told me last time, this before we started using dental pain arrays. She's like, George, do I have to go to the dentist, right? This is my 80-year-old mother, right, telling me do I really have to go? I'm like, Mom, come on.
Mom, you do. Right. You used to ask Mom the same question. Ma, do I really have to go to the dentist? Well, now, now you do, Ma. Right?
Exactly. Role reversal, right? So
exactly.
So what we did, it was great. I mean, we pre-applied at home Again, she applied it at just before she went to the appointment. Just around the areas that she knew she was going to have a cleaning, because she's got a bit of periodontal disease, not extensive, but a bit of like inflammation, etc. And she pre-applied it, and then we went to the dentist, and then they just did some reapplication and some deep pockets that she has, and she was good. She did her appointment, she got her cleaning, then she walked out, and she was happy for once, actually.
So let's take a step back. What is the dental pain eraser, and how does it work?
Yeah. So one of the key things as part of the Eureka moment is making it affordable and accessible. So we are the first handheld pen-shaped device that can be applied by the clinician at chairside or even by the patient at home. So it's just a very simple, it's like almost like a pen. So if you look at it, and I can show it in my hand how small it is, there you go. So it's simple, and you apply it in the area just for a few seconds, and you've got relief for up to 48 hours. So it's really, really innovative because it's easy, safe, and you can apply it anywhere. So you can go apply it at home. You can give it to your child. It's safe for children. You don't have to pop pills. It's long lasting. Again, it's a very easy, safe, effective means to, achieve that consistent, comfortable feeling.
Okay. So, people that are a little, anxious or what have you, what's going to stop them, or is it going to stop? Is there like a governor on it? So if they keep it on there, because I'm going to keep this on for half an hour, to make sure I don't have pain. So is there any issues with somebody overusing it, or once you hit a level, you're at there no matter what?
So, our basic rule of thumb is apply it until you have relief. There is a timer, which is 5 minutes. Our label from the FDA, it says no more than 10 minutes at a single session. But you can reapply it as much as you want, as necessary, to achieve that relief. So ultimately, you just reapply it as needed to achieve that consistent, feeling of comfort. Like, give an example, people have TMJ or TMD issues, like, that soreness. Some people that have clenching and bruxism. People are pre-applied before even they go to bed, just for 2-3 minute applications per side to achieve that comfort. So when you wake up in the morning, you don't have that achiness, the headache that actually can occur for those that have issues with, that clenching, bruxism, TMJ issue, which is quite common, especially with COVID.
Right. Yeah, no doubt. So what kind of feedback have you received from your partners and practitioners who are using it, and why does patient comfort matter to them?
Well, one of the things, it's what's happening in dentistry and orthodontics. And again, to give a bit of color, Dr. Cosmo is an orthodontist, and he deals with a lot of complexity because he deals with, lots of complex cases, but simple too. So really, what from an industry perspective that we have found from feedback is that people have acknowledged that, getting new patients in the door, new business, is really important, because as a business operator, you have to run a business. You have to be profitable to provide the best care. So really, bringing that new patient in is very important. So really, how do you differentiate yourself from the others in the market, provide the best care, best technology, best solutions, and patient experience specifically matters, because it's all about differentiation, why they should come to see you, close, meaning they say yes to you, saying yes for treatment. So you have to eliminate that fear, anxiety that is also part of treatment. And also, even during the journey, making sure that they have that consistency of experience, even when they leave the chair and at home, because now people are very social. They post on Instagram, they post on TikTok, So making sure that they're really positive about their appointment, not only in the practice, but also when they're home. So really, this has been a game changer because you can apply it easily, it's effective, and it's long lasting. So it's really a practice transformational tool because it hits all the key points of being successful in practice today.
On average, how long does the patient use the pain eraser for? Is it generally a 24-hour thing, 2 days, 3 days, a week, 2 weeks? How long is something that they're actually using?
It does depend on what type of treatment they're undergoing. So if they're in general practice, they just a cleaning, typically they may pre-apply just for a few seconds per tooth, 10, 20 seconds. In ortho, when it's more achy pain, that one you apply after the appointment, typically, because it's all about moving teeth around the PDL, the periodontal ligament. So that can be from 30 seconds to, and you'll typically will have relief in one area. Now, if you're having it at chairside, let's say for replacing the needle for an injection, that's going to be for 2.5 minutes because you're cutting the needle out for some of those caries that you may have and treatment of caries. If you got TMD issues, you have to do the whole musculature itself. So that's going to be like a 4 to 5 minute application. So really, it's dependent on the type of relief that is required.
And is it one and done, or is this something that if they continually do over the course of several days, or is it just right away after the treatment you finish?
Usually, it's done. The relief is 24 to 48 hours, and you can reapply. Now, some people may just may want to reapply longer, so they have a longer relief. So it is dependent on how much you apply. So the more you apply, the longer relief you'll have. But typically it's 24, 48 hours. So let's say you have an adjustment, and when you have that first week of braces, which typically is, I've had braces, all my friends have had braces. So that first week is tough because you're on the liquid diet, you can't eat, any hard foods. Just imagine that you can apply this daily or basically for the whole first, 3 to 5 days of that first week, and you can start eating whatever you want. You're not limited to soup or the liquid diet. You can just start having good dietary consumption and actually hygiene. Your hygiene is not going to be compromised, right?
So now let's talk from a clinician's perspective there. So most dentists, orthodontists are facing stricter competition than ever before. All right. So now they're looking for ways to position themselves differently in the marketplace. So talk us a little bit about how to integrate the dental pain eraser into a practice to attract new patients and how to make them position themselves to be a little different.
Yeah, no, it's super important because ultimately, again, differentiation does matter in the marketplace. So being the best you can be and communicating that effectively, both from your social website to anything campaigns that you do in community, is we provide when doctors and practices say yes, they integrate the dental pain eraser is, come to us. Why? Because we're the best, most comfortable treatment experience possible. So they integrate it as part of the value prop. They lead with it, comfort experience, and it does bring patients to the door. I mean, we have exciting thing is that with that home unit, which is the white unit in my hand, they're actually now giving as part of the patient care kit. So when you start treatment or when you have an emergency, let's say you've got a mom who brings her child in after trauma, guess what? You've got this, you can take it home, you can treat the trauma at home. You don't have to take anything else. It's great. It's convenient. So really that differentiation of being comprehensive, meaning an approach of both in-chair and post-chair when they leave for home is super important because that's the unique advantage that practice will have as being comprehensive, best-in-class care because comfort is the key experience.
As I mentioned, so now, guys, as a professional, dental professional, orthodontist, why don't you think what makes you different than your competitors? Okay, what makes you stand out? And write these down. Or think about what is your differentiator, what makes your practice different, and then take a look at that list. Write 4 or 5 things down, and then think how many of those things that you wrote down the patient cares about. It's not about you; it's about them. So comfort, as George said, is super important. All right, so George, why don't you tell us a little bit about how practice can really stand out by saying presenting themselves with comfort and marketing it that way. And that's some of the things that, you and I have done with some of the practice that we have and work together on. So, what's one tip that a practice that you would suggest right now to say a practice could do to make themselves stand out using Synapse?
Well, one of the things is that we become part of the marketing budget for the practice. An example is that we provide the practice branding extension on the dental pain eraser. So basically your brand is situated on the dental pain eraser, so it's provided by you, the provider of care. So really your center as part of the delivery of comfort. We're just the technology, the enabler, but it's you, the provider, who's actually providing that. And that's why we did that custom branding option for people who buy into the dental pain eraser, and it's available to everyone. So you can be an orthodontist, a general practitioner, and we even have people that have dispensing to pedos, like when teething. We know, with the sleepless nights and your life of teething occurring because you have eruption, people are using it as part of like, hey, I need some quiet time. I need to sleep a few hours. So they're actually giving it to their babies to address teething, and it's all branded. I mean, they're giving branded units, and it's like a lifesaver for these parents. Like, thank God, I've got this, and I can actually have relief, and the kid's happy, I'm happy, everyone's happy, right? And it's all because of the provider, right? You're the hero,
right? And it's good to be a hero. So speaking of heroes, why don't you tell us what's the best response that you've heard or feedback you've heard from a practice who you're working with? What came out of the blue that really blew you away and made you super happy?
Well, we receive stories all the time, and it can be anything from, it saved the day for me. Like, really, I mean, anything like, I had, patients coming in, they were uncomfortable, they were, and they were treated with a dental pain eraser, and they're like giving hugs, like crying of literally people like saying, thank you so much. Because again, you're taking people out of pain or discomfort. They're going to give you 1,000-fold, better reviews of anyone that will give you just like, oh, great service. I mean, these patients are really have high levels of gratitude and we receive testimonials and videos and from practices that are posting on Facebook and Instagram, recognizing the impact that it's had. So those are some great stories, or even like not stopping treatment, or allowing patients to come in for cleanings or treatment. Those are big wins for the practice and great business development, for the practice, because it's all about bringing new patients in and retaining them. That's
it. Yep. From our perspective, at Ortho Marketing, our job is to bust in the seats and position our practices differently. And this has been a game changer for some of our practices that we work with together, because now we have the ability to make them different, to make them stand out, and to offer comfort, and to be able to really position them as a leader and offering something different in the market than just the same old thing. So now, that's one of the great differentiators about, working with a company like Synapse and offering this into your practice, is you have the ability now to position yourself away from your competition, all right, and to offer something and that's different, at the same time, make a difference in people's lives, and if you can make somebody's life better and happier, you hit a home run there. Let me ask you two more questions, George. So, as an entrepreneur and in the tech business, I've had a lot of industry leaders on my podcast before, and it's incredible. I love talking to entrepreneurs and figuring out their journey and what have you. So, if you had a time machine and you could go back 2 years, what's one bit of advice you would give yourself to do that you, as far as different?
Well, I think really is to focus and work and embed ourselves. I think we were maybe a bit too broad-based in focus 2 years ago. But I think, really doubling down and focusing on, execution on the orthodontic space, because that's where we started off, and we decided to expand a bit, but now we're really focused on orthodontics, but also developing pedo, GP, and other segments, because again, the opportunity is huge. Demand is there, the need's there, but really focusing, and that's why the past about 24 months, we've actually seen a massive response from the profession, and that has led to us winning the AAO Innovator Award last year, and also the Ortho Tank as well, and also other industry accolades. So really, focus, execution is the key.
Focus is so hard. You get caught up in things, and if you go one way, then you have to get back on the other. So stay in your lane. Focus is so important no matter what you do. All right. So sorry, I said 2 questions, but I still have 2 more. All right. So if Synapse was writing a children's book, what would the title be?
That is a good question. Children's book, I would say something along the lines of making that first impression matter. Because again, children are very impressionable, right? And their first experience creates the foundation for their next 10, 30, 40 years. So that's why, and just going back to one of the segments that we have really a lot of pull now is PETA, because they have probably the most, if not, I think probably the most sensitive patient itself, and having that experience really for those patients a positive one, their first interaction with pedo or the GP, very important.
Sure. So if somebody wanted to get more information, learn about it, become a partner, what's the best way would you suggest for somebody to do so? Because obviously let's even take one step back. You're going to be at AAO this year, which down New Orleans. I'll be there as well. So what booth will you be at? And if somebody wants to use this ahead of time before the show, how would they be able to reach you in person? And then afterwards, what's the best way for them to reach you?
Yeah, I mean we've got a comprehensive website where you can actually request a live demo with us. That is the best way to experience the dental pain eraser, because seeing is believing. And we actually do live demos with providers and the teams, and they're like, wow. We kind of build the wow factor, and we make it fun and we make it interactive with the team. So I always encourage people, go to the website, book a demo, and we'll make it happen for you and the team. So it's all about creating fun and with the team and making sure that everyone's successful when they say yes to dental pain eraser.
And the website URL is
dentalpaineraser.com.
Perfect. Good. All righty. Great. And if somebody wanted to reach out to you personally, who's had some questions or wanted to become a partner, but in addition to that, what's the best way for them to reach you as well?
Email. Super easy. All right. Email is george@synapsedental.com.
Great. Awesome. All right. So now I have one last final question for you, George. Okay. So I don't know if you saw on your phone while we were talking about it, I just got a text that an asteroid is hitting Earth in 3 hours from now. So you got to run after this, and you have to go to the market and pick your last meal. What are you eating?
Ooh, That is a tough question. But, I think I'm a very simple person. I have to go to my staple, though it's hard to get. I'm a big fan of Greek yogurt. But it has to be really good. So I do like Greek yogurt with nice artisanal honey and some other nuts or fresh fruit. That's my go-to.
So your last meal is yogurt.
It's yogurt with honey and other things.
Any particular flavor? Any fruit
No.
or anything? Nope, just plain.
Just
Plain?
very
Plain
high
Greek
quality
yogurt.
Greek yogurt
Really?
with
Okay.
artisanal honey and freshly roasted nuts. Is my go-to. I know
There
it's
you go.
simple, but if
All
you've had some Greek yogurt that is true Greek yogurt, you know what I mean.
Awesome. Great. Well, George, thanks so much for joining. I really appreciate it. Guys, reach out to Synapse. These guys, they're great. They're great to work with. I said, we work with them. We work with many of our clients, our partners with them. We're working with them and helping them with some marketing as well, positioning practices in the market to be different, to stand out. And this is a great opportunity for you to make a difference in somebody's life and to make yourself unique in the marketplace. So highly recommend it. I've gotten some great feedback from many of our clients and through the industry. And it's, you don't win an award like they did by accident. So, I don't, basically support many companies out there or throw my hat into it, but I think these guys are great. So, George, well done so far. Look forward to the future with you. And again, everybody out there in podcast land, please reach out to these guys. They're great. If you want to just do a demo, they'll help you out. Very hands-on, great team, real personal, and they're awesome to work with. So George, thanks so much. I really appreciate it. Everybody in podcast land, thank you so much for listening. Again, we love your support. We love your feedback. If you guys have any questions on here, please reach out to us. Follow the show notes, and again, reach out to Synapse. They'll make you smile. So everybody out there in podcast land, thanks so much. Keep marketing and happy smiles.
Orthomarketing.com. 360-degree digital marketing solutions for your practice.